Is your anger affecting you? There are a lot of articles regarding anger, and it is always associated with depression. These are very broad topics, but for the purpose of this video, we will include them and talk about the negative effects of anger on the aspect of physical health, psychological health, and environmental health. Anger is an emotion that we got since birth. Some believe that fear occurs first before we use anger to express fear. Studies say that fear and anger have different neurological pathways, and we experience these emotions in distinct ways in the brain and body. When we get angry, we experience increase in blood flow, heart rate, systolic blood pressure, and cardiac output. The impact of these increases vary depending on how we recover. Some people can become angry and recover quickly and return to the normal level of cardiovascular state, then those people have difficult time letting go. People who have a hard time letting go of anger will remain angry for a long time that cause them to have cardiovascular symptoms for extended time. For these people, prolonged anger can progress to heart-related diseases. Rumination not only causes cardiovascular illness, but can also be a trigger for a depressive episode. Individuals who have difficulty with expressing their anger in a positive approach will often get angry with themselves. They get angry because they feel they did not stick up for themselves. For example, an employer that gives an unfair evaluation and you want to tell him that you feel unfair about it. However, you opt to accept the unfair evaluation to avoid offending or upsetting him. Maybe it is anger over not having control of the situation, such as being fired or not getting a job that you want. In other cases, anger can be self-directed even if people do assert themselves. For instance, if you want to say something to your employer about his unfair evaluation and in your anger you yell at him, you may ruminate on how the conversation might have happened differently to generate a positive outcome as opposed to a negative one. This anger can easily turn inward in blaming yourself for getting fired and may result in a significant depressive episode. Lots of major depressive episodes have their roots in unresolved anger, self-criticism, and rumination on that anger. Anger rumination can also impact the environmental level of a person. People who tend to ruminate about their anger express it in unsafe ways. It is a fact that people who experience road rage and do unsafe driving patterns have unresolved anger problems. These people tend to drive at high speeds, take risks while driving, and exhibit aggressive driving. As an outcome, the level of frustration and anger increases. They are putting everyone on the road in great danger. These are just some of the ways how anger can have negative impact on our well-being and the welfare of other people. Many people with anger problems believe that they should not be experiencing anger at all. They focus on the fact that they get angry in the first place and ruminate on it rather than acknowledging their anger and how to express it in a good way.